Welcome, sir.
Yeah.
Somasundaram.
Geeta, madam. Good evening, madam. Satish, sir. Good evening.
Good evening, sir. I should.
Yes, sir. Good evening. Bala, sir. Good evening.
Good evening, sir.
Good evening.
Dr.
Welcome
Jalil.
all our Tamil
Sir,
Nadu office bearers.
Dr. Sukumaran also has joined. Sir, good
Yeah.
evening, Dr.
Good
Sukumaran.
evening, good evening, good evening.
Yeah, good.
Good evening, Dr. Thiru, Dr. Narmada.
Yeah, Dr. Rajkumar, Suresh
Good evening, sir.
Sir, Dr. Suresh Balan. Good evening.
Raj.
Dr. Naushid. Yeah.
Good evening, good
sir.
evening.
Good evening. Good evening, sir.
Good evening, Dr. Naushid. I think Thiru. No, I think he.
Good evening, ma'am. Good evening,
Good
ma'am.
evening.
Yeah, Thiru. Thirujanam.
Vanakkam, sir. Vanakkam,
Good
sir.
evening.
Vanakkam,
Good
sir.
evening.
Suresh Balan sir is 222 Suresh Balan sir.
Yeah.
Rajkumar sir, good evening.
Good evening, madam.
Geeta Patel madam, good evening.
Good evening, sir. How do you manage, sir? Traveling, you are so there. That's the reason you are shaking, vibrate like in the train, I think.
Yes.
Dr. Jalil.
Yes,
Good
sir.
evening.
Jalil, sir.
Yeah.
Is,
Sir, good evening, sir.
Yeah. Good
Good evening, sir.
Good evening. Good.
Can we start the program so that while we finish the formality?
Yeah, exactly 8. Yeah, you can start.
A very warm good evening to people who have joined in the platform.
Your voice is a bit low.
Yeah.
Your voice
Okay, can you hear me now?
Yeah.
Yeah. It is
Good
okay.
evening to
Yeah.
all the delegates who have joined on this platform as well as in YouTube. We are very happy to invite you for yet another IAP Presidential Action Plan of IAP TNSC, the specialty series. This month we are very happy to have our own environment chapter stalwarts on the stage to discuss a very important topic on environment that actually impacts our office practice. And we have Dr. Sukumaran sir, who is the founder chair of this chapter, along with us as the chief guest, which is a great privilege today. Before starting the program, I would request my dear friend Dr. Rajkumar to deliver the pediatrician's address.
Thank you, Narmada. Pediatrician's prayer. Grant us the quality of holistic healing. May we humbly realize how privileged we are in being bestowed with the ability to alleviate suffering. May we be emissaries of health, learning, charity, love, peace to all children and their families, irrespective of status and creed. Give us the wisdom, understanding to change the things we can, retain the good and accept within reason the things we cannot change. Grant us your blessings, grace and mercy in all situations at all times amidst all people. Thank you. Over to you now.
Yeah, thank you so much, Dr. Rajkumar. As Dr. Somasundaram took over as the president of IAP TNSC in this year, we wanted to give more importance to the subspecialty chapter that was formed under the leadership of Dr. Rajendran and continued and with Dr. Somasundaram. So the specialty chapter gives the pediatricians one opportunity to look into the dimensions of the subspecialty in a more detailed way. So I would now request Dr. Somasundaram, President IAP TNSC, to deliver his welcome address and explain about the CME. Thank you.
Yeah, thank you, Dr. Narmada. So, good evening, the delegates on this platform. The founder chair of this environmental and child health chapter, Dr. Sukumaran sir from Kerala. Welcome you, sir, to this platform. And the office bearers of Tamil Nadu ECHC, Dr. Balashankar sir, Dr. Amalraj, and Dr. Venkatesh, and the speakers for this today, our own secretary, Dr. Narmada, Dr. Balachandar from Dr. Balachandar, Dr. Naushat Ali, Dr. Geeta madam, and the chairperson of this chapter, Dr. Balashankar sir, and our academic coordinator, Dr. Manohar, our EB members, our past presidents, our president-elect, Dr. Tirumurugan, our past president, Dr. Suresh Balan, Dr. Aram Sendil, and many more delegates and office bearers and executive board members who have joined on this platform. So, as our secretary, Dr. Narmada, told, so we decided to have the last Sunday of every month to be allotted for the subspecialty, because we have almost 10 subspecialties chapters functioning under the IAP Tamil Nadu state chapter. So, but we are not able to have physical conferences or CMEs planned for all the subspecialty chapters at a particular place. So we thought a subspecialty CME online between 8 to 9:30 with one talk followed by a panel discussion will be the right way to make the subspecialty function in a great way, and also to take the what are the contents of the subspecialty to the delegates. So in that way we started, and every month we are functioning very well, and we have completed 5 subspecialties, and this month it is the turn of Dr. Balashankar sir and the team to do the rituals for this chapter. And I hope this event will be a great help to and benefit for all the delegates who have joined on this platform. And thank you all for accepting to be the faculties. We have faculties from Tamil Nadu, Kerala, and Karnataka. So thank you all who have accepted the invitation and have joined on this platform. And welcome Professor Singaravelu sir, the President-elect of Central IAP, who have also joined on this platform. Welcome you, sir, for this subspecialty chapter CME. And thank you, and over to Dr. Narmada to carry out the proceedings.
Thank you so much, Dr. Somasundar. Now, I think we'll ask Dr. Singaravel to, Sir, President-elect CIAP, to talk as he is on the flight. Sir, over to you, sir.
Thank you, Dr. Narmada. And thank you for giving me this opportunity as I'm in the flight. Our respected President, Dr. Somasundaram, and Sub-Chapter Specialty under the leadership of Balashankar, and Founder President Suresh Balan, Venkatesh, and the entire team of this thing who brought today the galaxy of people in the nation who are committed for environmental chapter, the founder person and the leadership of my guru and my mentor, my good friend, the Professor Sukumaran sir is here. Welcome, sir. Very happy you are here. And all other, our Satish Agarwal and Geeta Patil ma'am and Bala and all our people who are really committed for this. Thanks to Narmada connecting people all of national stature with our subspecialty. Definitely, it is going to be a very useful academic thing, and really it is a great honor that our Tamil Nadu environmental chapter under the leadership of Balashankar and our President Somasundaram and Narmada coordinating very well. Every month it is going very well in YouTube. A lot of people are joining, and we are getting a very good feedback. Our Manoharan sir is there. All stalwarts of our Jalil, everybody is here. So definitely it is going to be a very useful program for all of us. Thank you. Happy learning to all. Over to Narmada.
Thanks, sir, for joining in from the flight and blessing us.
Pleasure.
Before we go on, I would like
request
Dr. Balashankar sir, chairperson of IAP ECSC chapter of Tamil Nadu, to take over along with Dr. Venkatesh, the secretary of the environmental chapter. Over to you both, sir.
Very good evening.
Doctor, sir, sorry to interrupt. Usually, Dr. TN Manohar, our academic coordinator, is there.
The specialty chapter.
No problem. You carry on because of want of time. You can.
Yeah, sure. Yeah, sure. Thank you, sir.
Thank you.
Sir, first of all, I thank Dr. Somasundaram for initiating such an innovative program of one specialty 1 month. And as you already told, it's a real gateway of introducing these specialties to the pediatricians of Tamil Nadu, because they should know what all the activities that are happening in these specialties and what are the latest scientific developments that are occurring in these specialties. It's a very good chance for everyone to learn. So I thank you, sir, for initiating such a wonderful scientific program and giving the environment chapter Tamil Nadu to host this 6th month event. And I thank my captains, Dr. Venkatesh and Dr. Narmada and others for helping me in all these activities and implementing this CME. And I should heartily thank Dr. Sumaran sir for accepting our request. In spite of his busy schedule, he is a national and international figure and he is very busy. And he has accepted being one of the pioneers in this environment field to be the chief guest of today's program. And I also thank Dr. Satish Agarwal, our own president of this environment chapter of India, for accepting to be the person who gives the keynote address today. And I also thank my panelist, moderator, Narmada, and all others, Balachandran sir, Naushin Ali, and Geeta madam, for accepting our request and come joined all the way on this Sunday to enlighten the people of Tamil Nadu and maybe possibly other states regarding the environmental child health issues and its latest development in the field. Once again, I thank all of you for giving this opportunity, and I think we will start the program today.
I request Dr. Tirumurugan Saren, President-elect IAP TNSC, to deliver a short felicitation. Dr. Tirumurugan? Okay. I also request Dr. Manohar sir, our academic coordinator, to deliver a short felicitations.
Okay. Okay. Thank you, Dr. Narmada. Thank you very much. Thank you all the delegates who joined on this platform. Every pediatrician treats children from various sectors and various demographic regions. And the environment plays an important role in the genetic gene expression, the synaptic formation in the neurons, and also the pituitary adrenal axis, pituitary adrenal axis. And so these environmental factors will decide how a child's health will come out over the years, a social, mental, and physical well-being. So if the pediatrician knows what are the factors that will affect, environmental factors that will affect the health of the children, and if we can guide the parents to overcome this, it will be very helpful in bringing out healthy children. It's like probably Neelakandar, the Shiva, swallowing all the toxins and giving good life to all the persons in the universe. Likewise, pediatrician can do that job by giving proper advice regarding environmental factors that can be easily modified by all the parents. So thank you all the illuminaries who have joined on this platform to give us the information about child environment and health. Especially Dr. Sukumaran, Dr. Satish Agarwal, Dr. Narmada, Dr. Balachandar, Dr. Naushidani, Dr. Geeta Patel, and Dr. Balashankar and his team. The members of Dr. Venkatesan and the other person.
Amalraj.
Who is it?
Amalraj.
Dr. Amalraj. Thank you. Thank you, all of you, for bringing out this CME. Thank you, Dr. Narmada. It's over to you now.
I request Dr. Venkatesh, Secretary of IAP, Tamil Nadu ECHC chapter.
Venkatesh sir.
K. Suresh Balan sir, past chair ECHC is there. Suresh Balan sir, over to you for a short felicitation.
Madam, very good evening and thank you very much for giving me this opportunity. Respected President, Dr. Somasundaran sir, Secretary Dr. Narmada, Treasurer, and the Chairman of this ECHC Tamil Nadu chapter, Dr. Balashankar sir, Dr. Manohar sir, learned speakers, Dr. T. Sumara sir, and all the national leaders of ECHC, Dr. Satish Agarwal, Dr. Balachandran, and my dear colleagues. Very happy that this program is being conducted by the ECHC chapter along with the IAP TNSC as a presidential action plan, the subspecialty program today, and hope the speakers having a wonderful session. As we all know that the El Nino, the super fast El Nino, and so many other things are across the globe, which are going to have a heavy impact on the environment of our globe. And so definitely the children whom we are the advocates have got a greater role to play with regard to the environmental chapter. And I wish this program a great success. Thank you, one and all.
Thank you, sir. Dr. Tirumurugan Serene, our President-elect 2026, to deliver the presentations.
Thank you very much, Dr. Narmada. My apologies. There was some network issue as a result of which I had to log. I got logged out. It is indeed a great pleasure that IAP TNSC has taken this unique step of making sure that every specialty chapter has its representation and takes the important messages to the rest of the pediatric community and all the doctors in general. And we all know how important the environment is to each and every one of us. Probably we don't realize the impact it causes on children. So it's really nice to have the big bosses of environment child health chapter, Dr. Sulmaran sir, Dr. Satish Agarwal sir, Dr. Narmada, Dr. Geeta Patil, Bala Shankar sir, Suresh Balan sir, and Dr. Balachandra sir, and Dr. Amal and the rest of the team to enlighten us. So my best wishes and for a grand success for this program. Thank you.
Thank you, Tirumurugan Serene. Now I request Dr. Venkatesh, Secretary of IAP ECSC Chapter Tamil Nadu, to take over and invite the chief guest. Dr. Venkatesh. So please unmute yourself, sir, Dr. Venkatesh.
Good evening, sir and madam. Welcome, Dr. Sukumaran, our national president, and Dr. Satish Agarwal, sir, our national ECH chapter, and our president, Dr. Somasundaram, and Dr. Secretary Narmada, and Dr. Rajakumar, treasurer, and welcome our Dr. Balashankar, our chairperson for the Tamil Nadu State chapter. Welcome you all for this wonderful CME. Thank you.
Thank you, Dr. Venkatesh. Now it's our pleasure and honor to have Dr. T.U. Sukumaran sir as the chairperson for chief guest for today's function. Sir has been the founder chairperson of this chapter as well as an allergy and asthma chapter also. Under his presidentship, Enrich magazine was also started. A numerous publication has enlightened all of us on the issues of the environment. Sukumaran sir is the reason and the main motivator for us all to work in this chapter and create an awareness among the pediatrician about the problems that happens in children due to the environment. It is our pleasure and privilege to have him as a keynote speaker for today. Sukumaran sir, over to you for your felicitation.
Okay, thank you, Dr. Narmada, the Tamil Nadu State President, my beloved friend, Dr. Somasundaram, Secretary Dr. Narmada, is a ECHC State Chairperson, Dr. Balashankar, the National Chairperson of the ECHC Group, my beloved friend, Dr. Satish Agarwal, other office bearers of Indian Academy of Pediatrics Tamil Nadu branch, and also the ECHC branch of Tamil Nadu, and my beloved brothers and sisters in the Academy, and dear friends. It gives me great pleasure and privilege to be here with you to participate in this webinar and CME program organized by the Environmental Child Health Group of Indian Academy of Pediatrics Tamil Nadu chapter. I should congratulate the chairperson, Dr. Balashankar, for inviting me and giving this opportunity to me. And also I should congratulate all other members of the environmental chapter for doing a wonderful program like this. And also we have with us Dr. Satish Agarwal, our national chairperson of the ECSC group. And last week we had the National Environmental Day celebration, and the National Environment Day was converted to National Environment Week by our friend Satish, and we had a wonderful program for 1 week together. We had a CME program, social programs, charity programs on environmental health. See, according to WHO, in more than 40% of our childhood problems, or it's a medical or surgical problem, some environmental problem is there, some degree of environmental interaction is there. So I always highlight the importance of taking a very good environmental history in all pediatric problems. You must look at look at the outdoor pollution, indoor pollutants that can produce a lot of problems in our children. The usual indoor pollutants are, as you know, it can be the dust mite, moles, cockroach, then lovebirds and pet animals. All this can produce allergy problems, and also the main outdoor and also the main irritant is tobacco smoking. Tobacco smoke, with first-hand tobacco smoke, second-hand tobacco smoke, and third-hand tobacco smoke can harm our children. So the environmental history is very, very important in all patients. During our last Environmental Day celebration, we had an excellent talk by Dr. Soumya Swaminathan. You know, Soumya Swaminathan, you all know. She was the chief scientist of WHO, and she was the director of ICMR director. She was the director. And in her talk on environment and child health, she said, the greatest enemy of our children now is climate change and global warming. See, climate change and global warming, the surface temperature of the earth is increasing, and this global warming can produce a lot of problems in our children. And it is seen that the global warming is due to increased amount of greenhouse gases like carbon dioxide, methane, and ozone. They are retained on the surface, and they will extract more heat, and the temperature increases. As the temperature increases, it can produce a lot of problems in our children. And this climate change can lead to air pollution, noise pollution, water pollution, heat pollution, etc., etc. And also, you can see that the climate change can produce floods and droughts, and this can lead to higher incidence of vector-borne disease like dengue fever, chikungunya, and other viral infections. And also, there's a high incidence of waterborne infections like typhoid fever, cholera, etc. And air pollution in general, the main culprit now is PM 2.5, particulate matter 2.5. Even the particulate matter affects not only children, but also even the antenatal woman. The exposure to air pollutants, especially the PM 2.5, during an antenatal period, antenatal woman, it can cause the placenta and reach the circulation of the baby, and it can lead to small 4 to 8 babies, preterm babies, high incidence of premature births. And it is reported that the exposure of this PM 2.5 can lead to congenital malformations like spina bifida, congenital malformations. And it can also produce a generalized vasculitis in the baby. And it is seen that there is a high incidence of all non-communicable disease as adults. They develop diabetes, hypertension, and stroke. And now it is seen that there is a high association between neurodevelopmental problems like autism spectrum disorder, then learning problems, etc., and hyperactivity due to exposure to this PM 2.6. And also, climate change can lead to decreased production of food, and this can lead to severe malnutrition in our children. So it affects all systems, and it is our duty to reduce the production of the greenhouse gases, and we must reduce the carbon footprint. We must reduce the use of fossil fuels. We must use the electrically driven cars, and also we must start walking, must use cycle, etc., to reduce the production of greenhouse gases. And also we should prevent deforestation, and we should plant more and more trees. This will help to absorb all the greenhouse gases. So, to summarize, what I want to say is that we must concentrate on environment of our children, because today's children are tomorrow's youth, and to have a very good youth and adults, it is very important that we should concentrate on children's problem, on environmental health, and we should do more activities on environmental health. And I am very happy that the environmental group, as national level and state level, are doing a lot of programs for our children. And with great pleasure, I declare that this program is being inaugurated. I thank Dr. Balashankar, my friends, Dr. Somasundaram, who is the president of Tamil Nadu branch now, Dr. Namada, the secretary, and Dr. Thirumarugan, who is the president-elect of the academy. Then Suresh Balan, Delhi, then our national president was also there, Singaravelu was also there. And I thank all of you for your cooperation and for inviting me for this program. And I wish all the best for this program. Thank you. Jai Hind, Jai IAP.
Thank you. Thank you so much, Sukumaran sir. Your words mean a lot and motivates us to do a lot of work on that. As we go ahead, we acknowledge the presence of Dr. Amal Raj, Treasurer of IAP ECHC chapter of Tamil Nadu, as well as who's also a Central EB member for the same. Now, we are very happy to introduce Dr. Satish Agrawal sir, who is the chair of IAP, Central IAP ECHC chapter. Sir has done a lot of amazing work this year to carry on the legacy of great people who were the chairperson of this chapter. This one, as Dr. Sukumaran said, it was an environmental awareness celebration week for the entire June month. Under his chairmanship, a lot of activities has been going on, and he has been very meticulous in sending videos of awareness for the public as well as for the pediatrician. He is the apt person he practices in Amravati, and he conducted the national conference 2 years before, and such a lovely environment. We all went and had a phenomenal time, and it was very well attended by all the pediatricians of Amravati. And I'm very sure at the end of his chairmanship, he would have increased the membership also multiple times. So Satish Agrawal sir, over to you to make us understand how we as a pediatrician can contribute to the environmental awareness and for the child health.
So, Dr. Norma ma'am, first of all, my regards to the President, Dr. Somasundar sir, IPV Dr. Singh sir, President Dr. Thirumarugan sir. Please excuse me if I'm wrong in making the pronunciation. Vice President Dr. Vishwanathan sir, Secretary, I can't say our own, but our own Dr. Norma ma'am, Treasurer Dr. Rajkumar sir, Academic Coordinator Dr. Manoj sir, and the experts and the chief guest of today's session, Dr. Sukumaran sir, the moderator again, Dr. Merman, and panelist Dr. Bala sir, Dr. Gita Patil, Dr. Takshivan, and Bala Shankar sir. Believe me, this is a very nice opportunity. I was just looking for two reasons. One is Dr. Bala Shankar sir. He's so gentle, so polite. He makes a request, but it's a kind of order. He just asks, are you free on 28th? So it becomes a kind of order. You have to make it on 28th. Sir, I'm really thankful to you. Next is Dr. Norma ma'am. Whatever work she can do, she does it to the perfection. Just give to just an example. All throughout environment chapter was supposed to be a very dry topic. Where a person comes, gives a lecture, goes away. She has brought the concept of how can we make it case oriented, and that made it more popular. Thank you, Dr. Ma'am. Dr. Sukumar sir is always a guide to us. Everybody has appreciated, and I really experienced it. Whenever I make a call, he immediately answers, and just in very few words, he gives the advice, keeps it on. Sir, thanks a lot to you. I really thank the Tamil Nadu chapter for two reasons. First of all, we are all looking for the pedicon, which is going to be a big success. Second thing, our own environmental national conference will be held by Tamil Nadu chapter. And this I can say with evidence because when the Tamil Nadu has put forth the proposal for holding the conference at Kolkata conference, they all kept Dr. Balasankar sir ahead being the leader. And Dr. Balasankar sir kept all the people around ahead saying, it is my team. So the best example of leadership. So thanks to all, and we are all looking for both the conferences which are going to be a big hit, big success. And the reason being the leadership and the cohesion the board do. Dr. Manoj sir very politely said, carry on. No ego problem, nothing. If you have the chance, then I will speak. Otherwise, let it be. Let the proceeding go on. That is the kind of attachment, the cohesion of any organization, the success behind that organization. So, if Dr. Marman, you permit, I will share this.
You can
Yes, sir.
share.
Yes, sir. Please, sir.
Screen is visible. I am audible. These two questions are always asked.
Yeah, you're
Yes,
visible
sir.
and audible, sir.
So the topic given is role of pediatrician in promoting environmental health in children. Myself, Satish Agrawal, chairperson ECSC from Maruti, Maharashtra. I had to make this Maharashtra because there is a capital of Andhra Pradesh also. I really put a thanks because this slide is to be put at the end, but I really put my thanks to, apart from all the post holder office bearers, the delegates who are such a large number attending things. And as Dr. Balasankar sir said, we have to learn a lot of things. Believe sir, I am also learning. Even while preparing this presentation, I have learned a lot of things. Now, is environment really affecting the children? Is it really a problem? If it is a really problem, then are the problems manageable? We as a pediatrician has got a role for advocacy and we have to advise at individual level and community level. So it will be all restricted to a clinical practice only. Now, just a case is written over here. A 4-year-old child with recurrent wheeze is on inhaled steroids. Despite good adherence, symptoms persist. On further questioning, the family lives beside a busy highway and the father smokes inside the house. Good environmental history has changed the management.
Yes.
I know all the people, they know the answer. The case is just put for arousing the interest. Otherwise, all the cases will be discussed by Norma Madam, only it is her domain. Okay, so why do we need to discuss the topic? I am very fortunate to have Dr. Sukumar sir always with me. Most of the things he has covered. Children, they are vulnerable more because of the anatomy, small size, physiology, because they breathe more air, they perspire more than the adults, and the development, hand-to-mouth activity, and the curiosity. If the environmental damages them at early age, it may lead to permanent morbidity. Children learn by imitation. So if the adults they follow good practices, children will learn them. We have seen it in COVID period. When the children were used to be brought over here, they used to go to the basin or the sanitizer. And this issue has been raised in Indian pediatrics also. Now, what are the problems faced by children? Air pollution, both indoor and outdoor. Contaminated water, extreme climate change. Dr. Sukumar sir has highlighted it. Now, what are the problems? Short term, any kind of infection, respiratory or other infection. Long term, stunting, neurodevelopmental delay, cognitive performance. You don't find any cause, but it causes the environmental cause. Chronic respiratory disease and adult NCDs. Hypertension, diabetes, everything. Now, what IP says, over quarter of early childhood mortality, very important sentence, can be prevented by modifying environmental risk. Initially, I said, is there a problem? We face all these other problems. Are the problems manageable? IP endorses, yes, they can be manageable if we follow the right practices. These are all the points of pollution. I am not going detail in all the environmental issues. I'm just taking a example of pollution. These are all the kinds of pollution. But I won't go in detail of all the pollution. I'll just take air pollution. Reason being, Dr. Sukumar sir. You can ask any question and I can confidently say that I can answer every question because Dr. Sukumar sir is with me. Just see the figures. 21 of 30 most polluted cities in the world, they are in India. Air pollution is the second cause of under 5 mortality next to malnutrition. Our life expectancy has doubled since independence till today. But because of the air pollution, it has reduced by 8 to 10 years, especially in Delhi. And in Delhi, when the AQI drops, inhaling that air, polluted air, it amounts to 25 cigars a day. Although it's an oversimplification, because apart in smoking, there may be other chemicals also, but just to show the things. And the fact which came out is that in Delhi, the age of incidence of carcinoma of lung has decreased. Initially, it used to be after 50, it has decreased. It is more found in females and that too in non-smokers. Reason being air pollution. Now, just to see the things, usually the manifestation of any culprit depends on the portal of entry. If it's through respiratory tract, it will cause the respiratory symptom. If through GI, then it will cause the GI symptoms. If it's through skin, it will cause skin symptoms or through eye symptoms. What Suman sir has impressed upon is the PM 2.5, the particulate matter less than 2.5 micron in diameter. Apart from respiratory manifestations, they cause non-respiratory manifestations. What does it mean? When they are inhaled inside, they cross through the blood, go in the blood and reaches various organs and they cause damage to that. Even if you take the example of pregnancy, it causes all the problems to the unborn fetus and later on the fetus. Now just see this infographic. On the left hand side, there are all the respiratory symptoms. On the right hand side, there are non-respiratory symptoms. Pregnancy, it may cause preterm baby, low birth weight baby, or all neuro development of psychological problems. We go to the next pollution, that is noise pollution. What is noise pollution? This is unwanted or loud sound, harmful to people and the environment. Causes we all know, is the traffic of the vehicles, household appliances. Remember, this is a very important thing. We run all the mixes and all the things, but they cause so much of a noise, may amount to pollution. Celebrations, construction work, and effects are, there are short-term effects, long-term effects. Learning difficulties, behavioral and emotional issues. Prevention, we all know, you have to remove the cause, reduce the noise at school and home, follow safe rules, and encourage quiet zones. Now, this is a very important slide. Balasankar said, sir, I saw this slide for the first time today only and made this bar diagram. The normal level of hearing is 65 decibel at daytime and during nighttime is 30 decibel. If it exceeds the limit of 75, it may become harmful. And it becomes painful and dangerous if it crosses the limit of 120 decibels. What does it mean? The DJ sounds, they usually offer the decibel of 115 to 120. Now, whether this noise will cause pollution or harm to the hearing, it depends upon the volume. We all see the safe volume and the unsafe volume and the duration of exposure. For children, noise above 85 decibels like busy traffic can cause damage over 8 hours. Just see 115 to 120 decibels, the sound created by DJ, can cause permanent hearing loss in less than 1 month. Do we really pay attention to this? Many celebrations, there is a condition that there should be one DJ. People will dance close to the DJ and ask the DJ person to make more and more noise. See how much is it harmful to us. And if it is harmful to the adults, just imagine the child health of today's topic. Now the thing is hidden hearing loss. What does it mean? If you go for testing the hearing, the usual test may not diagnose this hearing loss because the usual test will detect the hearing loss due to the outer ciliary cells. And when this loss occurs, hearing loss, it is because of the junction of the ciliary cells and the bone. So usual routine hearing test may not detect this thing. And the person or the child is really having hearing impairment. Just see, just a short video.
Here, People honk even when the signal is red. So, maybe they think that by honking, they can make the signal turn green faster. समझतच नाही.
Usual occurrence irrespective of the city. Now, a very important topic, noise pollution in the newborn. Specifically taken newborn because newborn is just a parasite, doesn't have any protective mechanism. It is just developing. It is hearing and all the inner ear mechanism has not been yet developed. They are never way to process or tune out unwanted sounds like the adults. Now, what happens even if they are exposed to these high sounds? The physiological stress will be heart rate and the respiratory increases. The oxygen level drops and they consume more energy, they become energy exhausted. The graphic on the right side is of an ICU where we hear all this beep, 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 beep. The door is being knocked, door is being closed so loudly. There may be a loud discussion between the nurses and the staff and other things. These all amount to noise pollution. And if they remain prolonged for a long time, it may cause cochlear damage, hearing impairment, and even permanent hearing loss. And we don't know the reason. All the experts initially during the addresses, they say the environmental factors are very important. Sometimes they may be overlooked. These are the reasons. Another very important thing, what is called as the temporary threshold shift, TTS. Excessive loud sounds like a concert of heavy machinery. If it occurs suddenly, we also have experienced the same thing. There may be dulling, muffling, or loss of hearing sensitivity for a moment. We just feel like we have lost the hearing. Why? Because the hair cells become physically stressed or flattened out, like kind of paralysis, resulting in auditory threshold shifting to higher volume. At lower volume, where we could hear the things or the conversation, now it will require higher volume. So this is called the temporary threshold shift. After the hair cells they come to the normal level, they recover after some time. And when they recover, so also the hearing. Now the very important statement, if they are repeated, the TTS may become the permanent threshold shift and may lead to hearing impairment, hearing loss. My again request to all for these DJs and one of our nearly district, Yavatmal, a delegation of our doctors went to collector to curb the increasing amount of DJ sounds. So that is how the noise pollution is reduced to our head. Now, the initial title, what is the role of pediatrician? The role of pediatrician is clinical assessment, what is called as the history. There is a separate discussion on environmental history. Now, what we need to ask, living condition, cooking fuel, AQI, occupation, construction. Identify the toxin. It may be laid in the form of surma or kajal, paint in the housing, although now the paints are coming or the toys are coming lately, but still you need to ask. Heavy metals in soil or water. In one of the recent studies in Delhi, the water and the soil were found to be contaminated with lead and its amount was around 18%. So we don't know what's occurring, but it is giving rise to various problems in the children. Recognizing pattern. If there is a cluster with the families or the neighbors, you need to differentiate whether this problem arising because of the genetic pathologies or because of the environmental factors. If it is because of the environmental factors, we can very well correct it. So this is the role of pediatrician. Now I'm just taking an example. Now, if there is an environmental hazard, like yes, we are just seeing what is the role of pediatrician. Outdoor air pollution. What is our role? We need to advise you monitor the local AQI daily. AQI means the air quality index. It is the parameter which measures the amount of pollution in the air. If it is more, so we have seen the problems of polluted air. If AQI is more than 200, ask the children for not any outdoor play or activities. Let them be indoor. Because we have seen all the way, the polluted air may exacerbate asthma or other respiratory problems. they may use serial cotton or N95 mask. But who is going to advise this? This is the role of pediatrician. Now there are 4 other such examples, but I taken this example only for the air pollution. Similar is the example for indoor air pollution, for vector-borne disease with the changing climate. As Dr. Sukuman sir has said, what is our duty? Like advising the mosquito barrier, the medicine impregnated mosquito net, and mosquito repellent adequate to this child. So all these things, this is our duty. And this is last slide because I was given the time and probably I'm within the time. No, ma'am?
Sir, you can
Sir,
continue,
of
sir.
course,
No, you can continue, sir.
So every consultation is an opportunity to protect not only one child, but also the environment in which the child will be. So at every consultation, we need to take the environmental history in detail. We need to advise not only to the child, but the family about the environmental protection. That is how we can protect our children. And that is the opportunity. So our role is not only for the clinical curative services. Our medical services comprise of curative, promotive, and preventive. Now the rehabilitative services have also been added, but then our preventive, and promotive services we need to do. Then only we can save our children. Our children are the future of country. We are all dreaming of a developed country by 2047. So this is our duty. If we are taking steps to protect our environment, the result may not be immediate, may not be immediate now only. It will take time. But being the pediatrician, being the guardian of our children, we need to protect not only the environment, the child health. And that is the duty, like how we are giving environment, the safe environment to the children. Thank you all.
Thank you so much, sir, for a very wonderful thing. One of the questions asked is, we all know that the environmental pollution is creating problem. What is the solution for it? And you have very beautifully explained what pediatricians can do about this. That's a very important thing because the awareness about the climatic change occurs, but we as a doctors, what we are going to do. So that was a very eye-opening session. So now we'll, without much delay, so we'll go into the next session of today. We are going to discuss on. So can you see my slides, sir?
Yes.
So we are going to have a look at what is the impact of the environmental issues in our office practice, for which we have experts, Dr. Geeta Patil madam, who has been a pioneer in this field, and she's been working relentlessly for the environmental causes from Bangalore. Madam is at present in the office bearer of and the chairperson in IAP in Bangalore. Dr. D. Balachandra sir was a past chair of IAP ECHC national chair, and under his leadership a lot of changes has been done in environmental chapter, and he is also going to be the president-elect of IAP Kerala. Dr. Balashankar sir, our past president of IAP Tamil Nadu State Chapter, sir has also has been the dean of Madurai dean in the government service and retired now, but he has contributed all his time for the benefit of the children, and he has at present done a lot of activities in the environment, and we can see the number of activities he does every day for the environmental chapter. Dr. Daushidani is an upcoming pediatrician in environmental chapter, but he has that kind of work he has done in Kerala. He has started the Green Army project, National Green Army project, sensitized number of children on the environmental issues, formed a small band of a Green Army, and these children are doing phenomenal activity in the schools for the benefit of other children, as well as he has conducted various conferences for the teachers also. So under his leadership, Kerala is is sensitizing many of the youngsters for the same, and we are very happy to invite all these people for a very important discussion on how does environmental issue impact your office practice. So environment is a hidden patient in every consultation. Every child you are going to examine, they bring an invisible history of the air they breathe, the water they drink, the food they eat, and the environment they live in. Unless until we understand from what is the background they are coming from, it is very, very difficult to treat, because pediatric diseases are increasingly shaped by environmental exposure. More than 1 in 4 deaths in children and in under 5 are linked to environmental factors. Climate change, pollution, microplastic, unsafe water are just one of the few which already we had discussed about the same. So the pediatric office is no longer a place just to diagnose the disease. We also need to understand what the environmental illness is. Otherwise, we will not be treating the children as a whole. And why should pediatricians care? More than 25% of all deaths are attributable to preventable risks. Over 90% of the world's children are breathing polluted air every day, exposing them to lifelong respiratory and cardiovascular risk. Nearly 2,000 children every day, they are dying in all over the world. Air pollution has contributed to 7 lakhs deaths, and already Satish sir had explained in detail about the same. The children are more vulnerable because they are not just small adults. They are breathing 2 to 3 times more air per kilogram than adults. They drink more water and consume more food relative to their body weight. So they have an immature lung, developing immune system, and a blood-brain barrier that is easily that can be breached by the environmental toxins. They are highly susceptible to the same, and the damages that are going to occur is going to accumulate over long time and cause environmental damage. So the pediatrician of today who is sitting in the practice is treating disease which are driven by air pollution, unsafe water, endocrine disrupting chemicals, industrial pollutant, and the environmental factors have become one of the largest risk factor in everyday pediatric practice. The greatest risk factor sitting in our consultation suite is not a virus or a bacteria or a genetic mutation. It may be the environment in which our patient is living. So having said that, I had a 16-year-old Neha who presented with persistent abdominal pain. Pain was so severe during the day and actually stopped her from going to school. There is no history of constipation, although occasionally the mother said that she had altered bowel habits. There was no weight loss or any alarming symptom. As usual, they came with the investigation. Ultrasound was normal. This is the investigation I did in my clinic. This is total count was normal, and you can look at hemoglobin was normal for the age. Platelets was no. CRP was also absolutely fine. And we did the routine LFTs and serum total proteins. Everything was normal. Kidney function test was normal. And we did amylase also to rule out any evidence of pancreas involvement. That was also normal. So with that background, they were so insistent that I did urine routine twice was done, one in the emergency and one we repeated in our hospital. Everything was normal. So there was no evidence of any urinary infection or any of the ultrasound factors. Then the mother was so insistent that the child is not comfortable. I asked them, are they sleeping in the night? Yes, they will be sleeping, but the moment she gets up, she complains and she doesn't want to. So is there any other school factors? I was explaining, but they said they was completely fine. So they wanted to do the CT abdomen. We did with the contrast. Everything as expected was normal. So as pediatrician, we all know the diagnosis is a functional abdominal pain. Balashankar sir, what do you think could be the reason? Because further analysis we went, weight was 85 kg and she was an obese child, and eats takeaway and weekly once hotel. The home, they were predominantly vegetarian, but they take non-vegetarian also. But the mother insisted, I'm very sure, we don't give her pizza or burgers. But when asked, they said that yes, we go outside and take. So Bala sir, what do you think further we need to investigate, or what could be the reason here?
Thank you, Dr. Narmada. It's a new terminology, environmental illness. I think that one environment history should be one of the part of history taking in our office practice. Thanks for bringing in that important thing. May I have the next slide, please? So, what could be one of the causes? We all see that so many problems like obesity and all these things are increasing day by day. And one of the possible causes for all these lifestyle disorders is the change in the environment. One of the important environmental factors that can play havoc in our children is the plastics. So plastics are ubiquitous environmental pollutions. Whatever I see in front of me, pencil, pen stand, my earphone, water bottle, everything is made of plastic. Our life is made of plastics. So they are ubiquitous. And small particles, less than 5 millimeter, they are the one which are called as microplastics. And nanoplastics are even lesser, smaller size, less than 1 micron. Both of them can enter our body and can cause a lot of trouble in our healthy life. They are found everywhere, as I told, in bottled water, seafood, salt, processed food, tea bags, food packaging materials, synthetic textile, kitchenware, etc. And they can enter through all the ways. They can enter through the food, the water, they can enter the gut, and through air also we can inhale. And after going to the larynx, it can enter the gut also. And infant and children are more vulnerable, as Dr. Narmada told, because majority of the products which we use in children, in starting from the feeding bottle, the toys and all those things which they put into the mouth are all made of plastics. And they are found in placenta and amniotic fluid also. That is the most important thing. So not only the person who is coming in contact, the mother is affected, even the fetus can be affected. That's the thing. Next slide, please. So any particular connect with the microplastic and gut inflammation? Yes, it can cause gut inflammation. This is a pictorial representation from where you can get these plastics. Plastics can be, we get microplastics either from the places where they produce plastics, where from the manufacturing site, it is getting polluting the soil and the water, then we are consuming that. Or it may be the plastic which you use, which on time, on heating and wear and tear, release small particles, plastic particles, and they will be entering our body. Next slide, please. In what way the plastics, microplastics can cause injury to the gut? We'll see. This is it can be either a physical damage. We all know that small particles, plastic particles will be sharp edged. So when they enter the gut, they can tear the mucus and the mucosa. Microscopic small tears it can cause by physical property itself. And it causes dysbiosis, that is, it disturbs the good microbial flora in our body, and it leads on to increase in the harmful flora and less of your lactobacillus, bifidobacterium and all, and your increase in proteobacterium and other disease causing bacteria, they proliferate in the gut, causing dysbiosis. We all know that gut microbiota is essential for maintaining the good gut health. They are essential for digestion. They digest your fibers. They produce a small chain fatty acid which nourish our gut. So it's essential for that. It is also important for regulating the immunity of the gut. It is essential for maintaining the gut integrity and preventing the organisms and toxins entering into the gut. So many functions this microbiota have. Destroying them will lead on to all their so many problems. And these microplastics can induce oxidative stress. What I mean is they increase the production of reactive oxygen species. We all know that these oxygen radicals can induce damage to the cell wall, mitochondria, and even the DNA. So they damage the gut. And disruption of the intestinal barrier occurs by breaking the tight junction. All these things lead on to chronic inflammation, a small, microscopic, or even obvious inflammation of the gut, and the immune dysregulation of the gut, and which can predispose to so many gut disorders, which we'll see in the next slide. They not only act directly on the gut, they carry so many other substances along with them, like bisphenols, phenols, and all those things, which are so many toxic chemicals they take along with the plastics inside the gut, and they can cause a havoc. And this is the pathway this is described. And this, yes, next slide, please. So we can take, ingest or inhale these substances, and these plastics can cause diseases like inflammatory bowel disease, irritable bowel syndrome, and non-alcoholic fatty liver disease, obesity, type 2 diabetes, CA colon, allergic disorders, and all those things. Yes, next slide, please. How can we prevent damage from these microplastics? First, we will see at the individual and household level. Avoid heating. First, don't use plastic at all. Try to avoid it wherever it is possible. You should strictly avoid heating food in or water in plastic containers. And plastic teacups are very dangerous, and tea bags are also dangerous. We should avoid. And we should take fresh foods and not the canned or processed foods. That's not good at all. And limit water consumption from plastic bottles. And wherever possible in our kitchen or everywhere in our use glass or stainless steel or ceramic cookeries. And prefer cotton, linen, and wool cloth than synthetic like terracotta, nylon, and all those things. They all contain microplastic. And take probiotic rich food to combat the effects of your microplastic. And at the community level and policy level, we should have a very strict policy for disposing the plastics. Burning the plastics is very dangerous. So plastic recycling is the best one. And we should dispose the plastics in a legally accepted way and avoid single-use plastics. These carry bags and all should definitely be banned from our community. And improved waste management is the one which is essential. And the safer food packaging should be instructed to the industries. And one more small thing has come up recently. You would have seen in the social media. Two kids have invented a way of removing the plastic, microplastics from our water and all. They use the crushed tamarind seed and magnet. They put it in the water and demonstrated that they absorb all the microplastics and your toxins in the water. So this may be coming up in commercial way to us, and in a year or two we may be getting some sachets which we can put in our water or food, so that microplastics will be absorbed and removed. We'll wait for the day. Thank you very much for the opportunity.
That is the reason. So many of them ask, how are you able to confirm? They have done a study comparing children who had abdominal pain due to inflammatory disease. They had found out the microplastic level in the stools was much higher in those children who had inflammatory bowel disease. So that was a very, very beautiful way of explaining. I think we should go beyond quantifying it as a functional abdominal pain. Maybe something else is lurking there. And as you rightly said, immediately we may not be able to do anything, but slow changes in the way the life cycle is, like high fiber diet, strict no to the plastics, may actually bring down the problem significantly. So we also, in the same thing, a 15-year-old boy was brought with a high-grade fever to my emergency OPD. The supportive care was given and parents were reassured because it was the first day of fever. And he just again came back the next 48 hours later with high-grade fever and rigors continuing. The boy at this time was sick looking, toxic and dehydrated. So the clinical presentation was, we gave the supportive care, danger sign explained, but on day 3 when he came with the worsening symptoms, we had to do the blood investigations. Geeta ma'am, at this time, can you please explain what was the, how could we have gone about? Yeah.
So I think this is a common scenario. Thank you very much, TNSC, all the office bearers, and my pranam to Dr. Sukumaran sir and our moderator for her intelligent and thought-provoking discussion, initiating. So this is a common scenario we come across in our OPD. So next slide. So it is already described, and always it comes in our mind is a dengue, but dengue comes acutely with a rash and abdominal pain. And thrombocytopenia will be little severe, and by this time we get a NS1 antigen positive. Scrub typhus, if you see properly examine, we can see a HR which may be a necrotic but painless. And then malaria we can diagnose with the thick smear, but it can be viral and parasitic. But now it fits in the first 3 to 5 days it is difficult, we do agree. This looks like a, next slide, it looks like a, it fits in our all the investigations show us a leukopenia, then it shows a inflammatory marker has raised, and there are mild splenomegaly, but no other thing like liver function tests are normal. So it fits in our enteric pattern. So next slide. And it's a great thing that it is done a culture, because many of us don't have a culture of doing a culture, but it is done here and we could grow the organism, Salmonella enterica serotyphi, and this is a sensitive to ceftriaxone and sensitive to almost all antibiotic, what we came to know, but resistant to nalidixic acid. So the question will be definitely will be asked is it a relapse or drug resistant? Let us see how this nalidixic acid resistant Salmonella typhi gives us a clue about what. It is a shows that there is a ciprofloxacillin, there will be a fluoroquinolone resistance. It is a higher fluoroquinolone MICs. Usually we don't see that. That is our problem. Ciprofloxacillin, though it may appear susceptible on routine DIS testing. This is because of genetic mutation happens, alters the drug binding site and reduces fluoroquinolone binding. So obviously this is a fluoroquinolone resistance, and this is a very important thing for us to know, because why this genetic mutation happens, let us see little later as we are going to go through this flow. Now next slide. So I think we all of us know that how the drug resistance changed, and it was a era of nalidixic acid till 1989. Next 10 years there was a multi-drug resistant typhoid started. Then next 10 years we used a lot ciprofloxacillin. But what happened after 2010 and 18 is a ciprofloxacillin extended drug resistant typhoid strain was seen everywhere and was not useful anywhere. Now next slide. So this is, I think, you want to comment, Narmada, about this?
Yeah, actually now we are going ahead with Pakistan had an extremely drug resistant typhoid. Luckily for now, the VVAC trial in CMC has shown sensitivity to ceftriaxone and azithromycin still. So we can see that the sensitivity pattern to both, it is still there. But when you look at the other antibiotics like ciprofloxacin, definitely the resistance has been, it is very severe. So we are just having 2 or 3 drugs for this disease which we are being combating every day. So ma'am, what do you think, what we can do for this condition, madam? Are we going to, is it contributed by the environment, or it
Yes,
is because we are abusing the antibiotics?
obviously, because next slide, we have to know that this typhoid is not only, I think this is a WHO report. Next slide. Can you go? See, it is a typhoid is a water management failure. We should not go on telling, oh, drug resistance has developed, let me go to the next antibiotic. But it is because of the pico-oral chain, that 5Fs, how we have to break that thing. And we know that contaminated water is a vector for typhoid, dysentery, cholera, pico-oral borne all the diseases. So we have to break somewhere this channel. What is a pico-oral chain? 5Fs everybody has to remember. We can tell in a simple words to our parents, or we can show them a poster. Like it starts from the feces, that is a source of the organism. After that there are 4 ways, 4 or 5 ways are there. Contaminated our fingers. I think there is a slide next, or which is, no, next to that is there, I don't know that slide. Okay, so maybe next to that, or is it there, I don't know. Next, no, I think go back. It is about the 5 F's are very important. One is a, we have our contaminated hands, contaminated water what we drink, contaminated food we eat, and flies which sit on the surface on the food, and fomites also. We have to remember some fomite surface area, it goes to the food. So why it is happening, we have to think in depth, because there is a poor sewage disposal, unsafe drinking water, and environmental contamination causes a recurrence of enteric fever. Go on advising the antibiotic resistance is going to develop. It is added by the climate problem. Disruption of the sanitation happens and it goes on increasing. So environmental transmission is the root cause of resistance, rather than our prescriptions we are writing indiscriminately. Next slide. We have to break this fecal-oral transmission chain by implementing wash. Wash we know, but how to implement we should know. There should be a safe water by chlorination, boiling, or safe storage of water. Apart from that, I think open defecation free, I think that certificate should be there. I think there is a drive by our Prime Minister to have toilets everywhere has made a lot of difference. We are seeing less number of diarrheas also. Effective sewage treatment is very important. We know that there are 3 important pillars, that is a wash, sanitation, and hygiene. So wash, clean, neat water, as I told, and then sanitation, we have to achieve that proper waste disposal. Apart from that, our hygiene, about very important 5 clinical critical moments. Wash the hands before eating food or feeding the child, preparing food, then before going to toilet, then changing the diaper or cleaning the child, or handling the sick patient. So these things have to be remembered, and food hygiene education should be taught in the school also. It is taught in a very creative way. We should implement that. Next slide. And So this is my summarizing very simple slide. See, the most effective prevention is not the next generation of antibiotic. It is a systemic disruption of the 5F's transmission wave through our robust wash infrastructure, which will help us to reduce the frequency of the infections. Less antibiotic use slows the resistance. So we know that robust wash infrastructure by proper safe water, hand washing, clean environment, very important, clean and disinfected surfaces, very important. Open air defecation should be avoided, and vector control, not only mosquitoes, this water, food, all we can prevent, and sanitation, all these things will help, not only the antibiotic. Typhoid resistance should not be thought that it is an indiscriminate use of antibiotic, but environment is the main factor, and break the chain. That is very important.
Very
Thank
true,
you.
ma'am. We had a 26-year-old who had typhoid encephalopathy, ma'am. It was very horrifying to see, and he was on ventilator for 3 days. So typhoid is becoming very menace, and the solution, in fact, lies in the environment. So, yeah, ma'am.
Can I summarize? Then
Yes,
you
ma'am.
take that nalidixic acid. See, first thing, learn how to read the culture report. So nalidixic acid resistant salmonella typhi tells us not to, as such, we don't use in children that much fluoroquinolines, but ciprofloxacillin upfront not to be used. Acknowledge that environmental contamination is causes a resistant crisis, and WHO recommendation should be followed. Wash principles, disrupt the 5 F's of fecal-oral transmission, and let us not forget about the vaccine, which is very important part of that. Apart from the environment, vaccine implementation, at least once in, I think, whatever IAP has advised, 6 months of age we have started typhoid vaccine, because our contamination starts very early. Thank you very much.
Thank you, ma'am. Now we'll just move on to a scenario 3, India's infertility treatment sector. We pediatricians are in a way benefited, but the infertility treatment is also experiencing a very significant growth with the numerous clinics and a large number of IVF cycles. India has over 2,500 fertility clinics, and I think this is because many of the clinics are not even registered, and the second largest market of IVF treatment cycle. It is expected to grow for $793 to 3,722 millions by 2030. And this is an annual growth of 16.5%. Imagine, none of the other departments can even think about such a growth. And it is anticipated to perform 5 lakh to 6 lakh IVF cycles every day. And this is a surging trend which has been documented in most of the thing. So Bhalat sir, what do you think now, as we have about 1.4 billion population on one hand, but at the same time we are having such an increase of infertility centers all over. So what do you think is the reason? Balachandar sir?
Yeah, thank you, Narmada. First of all, let me thank the IAP, TNSC, as well as the TNSC CSC chat for giving me an opportunity here. So next slide, please. So from this slide, you can see that the world, even though the world average of total fertility is around 2.5, and Indian average is around 2.1, till the NFHS data which came in the last month showing 1.9. Only China is behind us around 1.7 maybe. So on the right side, we can see that the infertility rates, that is about 20%. The South Indian states leading with Goa, Kerala, then Karnataka, Tamil Nadu, and Telangana, and occurring the first 5 sports. So India is having, even though India is having a fewer babies overall, but more couples are seeking fertility treatment, and this does not mean the infertility has increased by the same amount. It mainly reflects that it can be due to the late marriages or delayed first pregnancy, better contraception, or women's education, giving importance, urbanization, and smaller family counts. So a couple having the first child at 33 doesn't mean that low fertility, but also it can be biologically fertile. So let us see what is the why this infertility is increasing in India, and we can broadly classify into the environment and non-environmental factors. The environmental factors, mainly the there are three primary categories of environmental factors. The endocrine disrupting chemicals, as explained before by the speaker, and they are the specific group of chemical agents known to interfere with the hormonal systems affecting the reproductive and developmental health. And the second is the lifestyle choices which contribute to environmental impacts on infertility. The hypothesis, the hypothalamic pituitary gonadal, the HPG axis, axis the main hormonal system controlling the puberty, fertility, and reproductive health is specifically noted as being susceptible to the influence of the endocrine disrupting chemicals. Let us see that various EDCs, that BP, that bisphenol A, the DDT. This bisphenol A is found in plastics and food containers, DDT in pesticide residues, the dioxin as an industrial pollutant. The previous slide. And the dioxins, that industrial pollutants, heavy metals, lead, cadmium, etc. The phthalates, which are used to increase the flexibility of plastics in cosmetics and perfumes. And the lifestyle choice are the smoking, alcohol, the diet, temperature, radiation, and etc. Next slide. So let us see one by one that the first is the environmental pollution. This connects directly to the obesogens and the endocrine disruptors. The various environmental pollution, that air pollution, PM 2.5, polycyclic aromatic hydrocarbons, nitrogen dioxide, and ozone. These causes oxidative stress in ovaries, testes, poor sperm motility, implantation failure, and miscarriage risk. And this is the first environmental factors. Second is the endocrine disrupting chemicals like plastics and other disruptors like BPF, phthalates, and polyfluoroalkylates. So this causes disturb the HPG axis, affect the population, worsens the PCOS, and lowers the sperm count. The pesticides and heavy metals causes the impairment of the spermatogenesis, ovarian reserve, and embryo quality. The effect can summarize that the effect on the HPG axis by mimicking the estrogen or blocking the testosterone, alter the puberty timing, it can be early or delayed puberty, can reduce the sperm quality, and affect the ovarian reserve and increase the infertility risk. Next slide.
Yeah.
The lifestyle factors include the poor sleep, night shifts, stress, the processed food, the smoking. The smoking affects the sperm count, erectile dysfunction, oxidative stress, and lowers the fertility. Alcohol can suppress the gonadal hormones. Maybe that is why youngsters are not nowadays into the smoking and alcohol nowadays. And delayed childbirth, all this can alter the cortisol, melatonin, and reproductive hormones. The delayed childbearing is an important single largest contributor. So many urban couples start trying when ovarian reserve is already low. As you know, that female fertility declines after 30. And the rising obesity is due to the dietary habits and the sedentary lifestyle. The high energy diet causes central obesity, which causes insulin resistance and affects the puberty and fertility. And nutritional imbalance can disturb the hormone production and lowers the semen quality. The temperature in males, especially using laptop on the lap and continuous phone in the pocket, whether it is if it is in the shirt pocket, can produce cardiac problems. If it is in the pants, it will cause affect the spermatogenesis. And the radiation also affects the oxidative stress, DNA damage in gametes, and reduces sperm motility. And these are the environmental factors. Now, the non-environmental factors include the reproductive infections like TB, especially the genital TB, sexually transmitted infections, pelvic inflammatory diseases can silently damage the tubes and the endometrium. Next slide. So this picture shows how the environmental, behavior, and chemical exposure contribute to the female infertility specifically. The first is the sexually transmitted infection. As I said earlier, chlamydia, gonorrhea infections can cause infertility. The pollution, especially air pollutions, as I explained before. Chemicals and pesticides like herbicides, insecticides, industrial solvents, all can affect the ovulation. illicit pharmaceutical drugs like anabolic steroids, cannabis, chemotherapeutic drugs, all can affect the HPG axis suppression and ovulatory dysfunction. And smoking also can affect the menstrual disorders. Then the next, Amada, yeah.
Yes.
Then the poor sleep can affect the circadian rhythms, alters the melatonin and gonadotropins and affects the fertility. Chronic stress can also affect the cortisol, suppress the GnRH and affects the HPG axis. Eating disorders can suppress the GnRH and cause amenorrhea and delayed puberty, like anorexia nervosa. That obesity, I said earlier, then improper eating habits cause delayed puberty and anovulation. In short, the picture emphasizes that the environment, lifestyle together can reprogram the hormone systems and affect the reproductive health from childhood to adulthood. This picture shows how it affects the males. That bisphenol, mostly chemicals affects the male infertility. The bisphenol A can cause a low sperm count, which is seen in industrial chemicals. The polychlorinated biphenyls, which is seen in plastics and flame retardants, can cause hormonal toxicity and DNA damage. The perfluorinated compounds, which are seen in toys and food and beverage, can lower the testosterone and some abnormalities. Phthalates seen in as an androgenic effect, which is seen in solvents and personal care products like perfumes and plastics. And organophosphates can cause in pesticides and pharmaceuticals can damage the oxidative damage and reduce the spermatogenesis. So in short, the environment and chemicals and lifestyle and infections all can produce reproductive dysfunction and lead to infertility.
Very true and very terrifying also to think that it has got a significant impact on our practice from sperm to being the adult, wherein the environment has got a significant damage to the fetus and to the adult. Even conceiving becomes a very big issue, and it is alarming to see how the infertility rates and the amount spent in that is going to increase, which is really terrifying. So the IVF industry is booming. It is actually, what do you think, what we can do about it? It's not a healthy subject. Yeah.
So this IVF industry is booming so much, but it is not just because infertility is rising. It can be also due to greater awareness, less social stigma. Nowadays, everybody is proud of being treated for infertility, better access for that, and lower cost compared with the Western countries, and medical tourism and better success rates with fertility preservation. So next slide.
However, but this is something which has to happen naturally. So I think we need to really take care. So you can summarize your points for this.
Yeah. Yes. Thank you, Nan.
Yeah.
So this is a summary that how the environmental changes affect the female infertility. Modern environmental changes like pollution, chemicals, stress, heat, and altered lifestyles can disturb the ovarian endometrial axis through oxidative, hormonal, and epigenetic mechanisms, leading to reduced fertility.
So this was a case of a 7-month-old child who presented with complaints of respiratory distress. This was the third admission in the past 3 months. Child was admitted at 3 months for bronchiolitis. Then again he had a 5th month of life. He was admitted again. He had required a ventilatory support also. And this was the third episode he came to the OPD. So now what do you think, like this child, just 7 months? You cannot actually tell them as a bronchiolitis or just get away with it. No, again, it's not a pneumonia. Yes,
am I audible?
Yeah.
Let me thank IAP Tamil Nadu ECC chapter for giving an opportunity. In this case, the child has had 3 episodes of respiratory infection over the past 3 months, and child was one time ventilated also. So mostly under 5 visa. May be fit for recurrent lower respiratory tract infection. According to definition, we know more than or equal to 6 respiratory infection per annum, or more than 1 respiratory infection per month, or more than or equal to 3 respiratory per annum. In this age group, recurrent respiratory infection is most commonly associated with viral, commonly triggered by RSV virus or influenza or adenovirus. Bacterial infection which may present like pneumonia is other things. But case like recurrent respiratory infections, we should consider other underlying condition also. especially non-infectious causes are equally important. This include foreign body aspiration, congenital airway abnormalities, cystic fibrosis, and gastrointestinal reflux, gastroesophageal reflux with aspiration, and immune deficiency is another thing. And also atopy and early childhood asthma also we should consider. Therefore, it is essential to obtain a detailed family history of particularly regarding asthma, eczema, and allergy, pets using everything. And when it comes to recurrently, apart from above history, we should consider environmental cause.
Because this child did not have any atopic history, was absolutely growing well. You can see for a 7 month he was well preserved, so did not come
Yeah.
under the immune deficiency or a GERD. That's why.
That's why we are going to environmental causes. See this diagram, that is Bronfenbrenner ecological system theory. The theory says that the children health is influenced not only by biological factors, but also by the surrounding environment, including the family, home, school, community, and broader social condition. Therefore, the environmental history should be included in all pediatric, especially respiratory cases. Important environmental risk factors include exposure of tobacco smoke and indoor and outdoor pollutions, basically from biomass fuels, and overcrowding, crowded living conditions, poor ventilation, daycare attendance, and poor socioeconomic conditions, inadequate hygiene and sanitation, exposure to dust, mold, chemical irritant, all is maybe the cause for the recurrent infection. In this particular attention should be given to tobacco smoke exposure. We can see in the picture, the secondhand smoke increases the risk of recurrent wheezing. Everyone knows the second hand and third hand how is happening, and that second hand is handed smoke increases the risk of recurrent wheezing, asthma exacerbation, and bronchitis, pneumonia. Like ear infection is another thing, and impaired lung growth and sudden infant death syndrome also will cause. And third hand smoke, which consists the toxic residues left on cloth, furnitures, and other surface, may also affect the children's respiratory health because children frequently touch contaminated surface and place their hand in their mouth. So that also will leads to long-term cancers and so many lung developmental problem, asthma and allergy in the future. So next slide. To reduce the risk, parents should be advised to maintain a completely smoke-free home and car, and smoke only outdoor, away from the children. Wash their hands and change out clothing after smoking before carrying the child. In nutshell, of this case, recurrent respiratory infection in a child under 5 is most commonly due to viral induced wheeze, but a systematic approach considering infectious, structural, and immunological and allergy, and always include environmental cause in history, which is essential to identify the underlying diagnosis and guide appropriate management. So whenever case came to your OPD, think the environmental cause other than the normal common containing viral and bacterial infections.
In this case, the grandfather was the smoker, and then we had to really counsel the family. See, it is very easy to give antibiotics or step up on your inhalers, but we need to have a permanent. This way, the grandfather was the smoker here, and you also.
So every time we should take the history of smoking and everything, and this is the complication leads to the smoking. They mainly affect the cognitive problems and kidney disease, allergy, like that.
Okay, very true. Geeta ma'am, but adolescents seems to prefer, actually, as Dr. Bala said, that they are not preferring smoking or alcohol, but they got into the habit of a vaping or an e-cigarette, and they said it's actually not smoking. So what do you comment about this, ma'am? Because you are an adolescent specialist also.
Can you go to the next slides? Let us see what is mean by vaping, because I think electronic nicotine slash the chemical delivery system, battery operated device. Just I'm summarizing what is mean by vaping, that it heats a liquid to create an aerosol inhaled by the user. It is a single use one, please, we have to remember, and it is battery operated. It is a very small, like USB like or pen drive like small devices are there which cannot be detected. They are called as web paints, pod modes, or Joule, L-bar. These are all brand names. And what does it contain? It is not harmless water vapor, but toxic substances like propylene glycol. You might have heard about the cough syrups, no? How the problem happened. It is one of them. Vegetable glycerin, nicotine salts, flavoring chemicals, and ultrafine particles and heavy metals. And many of us or youngsters are not aware that it contains nicotine salts also. So I think just now Naushad and he has told about the first hand, second hand, third hand. It happens in vaping also. There is no safe level of nicotine. It looks like something like this. Very sleek things are there. Next one. So it is very easy to carry to the school or college because it doesn't give any smell afterwards. And though it is been prohibition of the Electronic Cigarette Act has come in 2019. I think Nirmala Sitaraman has passed that, but still it is available in the black market. And when it was a shops, the shops were raided, physical. But when it is digital platform, it is very difficult to catch. It is available on WhatsApp, Telegram, and there is a ban on the production, import, sale, storage, advertisement. There's a lot of imprisonment or penalty, but still it is going on. And our International Pediatric Association tells already we have seen about cigarette smoking, vaping, both go hand in hand and cause cardiovascular and respiratory risk. Next. So we have to know why adolescent use. Most of us are aware that brain is under construction, their dopamine level is less, they want dopamine surge, and their neurodevelopment is not complete, prefrontal cortex is not mature. Apart from that, social media, peer influence, attractive flares, perceived safety myth, and then stealth device means unobservable device, and many of them used to de-stress and easy illegal access. So it is easily they are using, and always we consider when obesity epidemic started, we thought it is only of the rich countries or in the cities, but now it is seen everywhere. Same way vaping is also going to come everywhere, and it is really a problem that e-cigarette and vaping associated lung injury is a emergency. And now let us see about the environment. We saw the physical problems. I think there is a one slide about the physical problem, cardiovascular, respiratory, metabolic, and whatever I told about the emergency, all are there. But beyond that environmental thing, we have to remember that first is electronic waste, which always we forget, and it is increasing. Vaping is going to add to that. And lithium, because lithium battery is there. Lithium, cobalt, nickel, mining will increase. It will cause a pollution of the soil and water, because lithium is also lithium, nickel, cobalt. They are the precious thing. We waste in that. Chemical contamination is there. So use cartridges leach the heavy metal, lead, nickel, chromium, battery acid, nicotine salt. Nicotine is a potent neurotoxin. It affects the aquatic life. It reduces the biodiversity. Our drains also, it goes into the waterways. So this is the second one, electronic waste, lithium waste, chemical contamination and biohazard. Apart from that, persistent plastic pollution. Already it is explained. I am not going into details of that, but these casings are hard plastic which is not biodegradable. Apart from that, ultraviolet light breaks down and contaminates the food chain. And those all the things are assembled with a glue. So recycling, though it is mentioned, it is very difficult. So they are seen in the vapes, landfills. It can cause, if you toss it, it may cause a fire also. Sometimes face fire also. This is the slide, I think, a very beautiful slide. Narmada has added about all the physical problems. So do you want to explain? I think metabolic, GI. So all the problem, cardiac, respiratory. So this is a pediatric emergency, which we should be aware now. Sterile inflammatory pneumonitis because of vitamin E acetate causing a persistent cough, chest pain, shortness of breath, fever, fatigue, weight loss, respiratory failure and death. And we should know how to manage. The time has come. We were only managing undernutrition. Now we are managing obesity. Same thing we have to do. Next slide.
Yeah, you want to explain about this lung, ma'am? This is a very big
Yes,
thing.
very
Bilateral
important
contractile
thing because many of us are not aware about it.
aware of it. Yeah.
So how to manage? Please, bilateral ground glass opacities.
Capacities might be due to this EVALI actually.
It is because a valley. and corticosteroid should be used in moderate to severe cases. There is a grading of that also. Supportive care, many times they require ICU care. And that time, I think you can rule out the infection. Most of the time, there is no infection. So remember, persistent cough, chest pain comes. Apart from that, already we were telling about indoor air quality. There is a threat that particulate matter 2.5 is liberated, penetrates the deep lung tissue, causes a lung injury. Volatile organic compounds, formaldehyde, acetylide, heavy metals, ultra fine particles are there, bypass normal respiratory defenses. Already we have seen third hand, second hand exposure. And what is the enforcement gap? It is sold in black market. We don't know what is the content. There are many contaminants. So, and the way it is done, the targeted to the youth, because we know that they are the target population. So next is our, I think this is a very difficult, though there is no implementation or advocacy. So American Academy of Pediatrics, though it is in America, these cigarettes are available, there is a age bar is there. So they have made this protocol. Ask every child and adolescent when they come to your OPD. We ask about tobacco, but this also. I have seen a children in 7th standard in one school. 4 children, boys were caught with the vaping. So, and advise them, more than advise, I can tell them, counsel them, explain to the harms, assess their readiness, develop the quit plan, and arrange the follow-up. This definitely helps and creates the awareness. Next slide.
I think the lung issue is something which every
Lung
parent-
issue is a very important, that EVALI is an emergency. So this environmental threat, lung problems, and though in spite of this is banned, it is available. So use this protocol, time being till the awareness is created. We have created tobacco awareness, and never use vaping to stop the cigarette smoking, because that is a wrong concept. So far, whatever we have done to stop tobacco smoking, I think Sukumaraman sir will be knowing that. I think Bhave madam has done so much work on that, and tobacco smoking reduce, but again we'll add to the problem. Thank you very much.
Okay, now we go on to a case where an 8-year-old girl comes with a breast enlargement from the last 2 months and tenderness on the right side more. She had no other secondary sexual characters and she was feeling conscious and she wanted to avoid, she was appearing overweight. Parents were worried that there was a very serious health problem, and we did the endocrinological workup also. So this was a premature telarchy. Bala sir, I think this is your own case in your clinic, right, Balashankar sir? So her examination, 154 centimeter, weight was high, clinical examination was normal, but Tanner stage 1 assessment. The head screening was negative, though she was 8 years only, we had to do because of this one. So she was a normal school going adolescent who watches TV and sits at home. So definitely obesity is a growing menace, and we are seeing much more number of children who come at 7 or 8 years with this telarchy, premature telarchy problem and premature menarche also. I had a 9-year-old who thing which is, what do we do about it, sir? What do you think could be the reason also? Sir, you're muted, sir. Bala sir, you're muted.
Sorry. Okay, I am audible.
Yes, sir.
As you told Dr. Narmada, these problems like premature telarchy, menarche, and on the other hand, PCOS, infertility in female and infertility in male, obesity, and all these things are increasing. We just say that these are all due to lifestyle and taking junk food and all those things. But we should not stop there. I think there should be some environmental factor that are playing a role in causation of all these endocrine disturbances. So what we come across today is this endocrine disruptors. These are chemicals, natural or man-made chemicals, that can interrupt the body's endocrine functions, which regulate a variety of functions. We all know that our hormones are essential for our growth, metabolism, development, sleep, sexual activity, reproduction, and everything. So they affect all these functions of hormones. And you should remember that even at lowest concentration, they can affect this endocrine system. We measure the hormones in microgram or nanograms only. Even if you send for thyroid and all those things, only small quantity of the hormone causes a large, major effect in our system. The same way, the small quantity of these substances, previous slide please, previous. can cause these serious issues in us. And fetus, infants, and adolescents, in which the hormones play a major role in their growth, are the one who are at highest risk. And they can enter our body either through ingestion, inhalation, or through skin contact. And the fetus can also be affected through placenta. Next slide, please. So this has been already told by Sir, and we should remember that parabens, phthalates, bisphenols, and non-steroidal estrogens and polychlorinated biphenyls, all are some of the environmental pollutants which can lead on to, previous slide please, can lead on to endocrine disruption. Important thing is this chloralkyl substances, PFAS. They are the ones called as forever chemicals, and they are something like plastics. They live in our environment forever and cause permanent injury. And we can see it in our food preservatives, personal care products, plastic manufacturing units and resins, food packaging, clothing, especially this raincoat and all those things, and fire extinguishing products, pesticides, herbicides, solvents, and pharmaceutical terms. Next slide, please. So we have been using triclosan soap. Even I have used some year back. We should know that it is one of the important antibacterial soap. It is present in that. That is one of the important endocrine disruptor chemical we have been using. Next thing. Next, so many same chemical heavy metals are also there, like mercury, lead, and all. They are all in plastics, and we all know children will be taking this plastic into the mouth and can lead on to the problem. How do they act? How do they cause the problem? They mimic like these hormones. They act like estrogens and cause. And they block the actions of the androgens. They can block the action of the hormones. And they can alter the hormone production. For example, thyroxine production can be curtailed by these chemicals. And they can interfere with the transport, metabolism, excretion of these hormones. And they can cause epigenetic changes. That is, the way you respond to these hormones is this depends on the epigenetics, and they produce some changes in our gene level. And you should remember that if these genetic epigenetic changes occur, we'll be having it for lifelong, and we'll be transmitting to our generations also. So what are the effects these endocrine disruptors can cause? First and foremost is the effect on the reproductive system. As I already told, in male it can cause decreased sperm count and infertility and testicular tumors, and in females irregular menstrual periods, PCOS, infertility, and endometriosis, and so many things. And in children, if they cross the in utero and affect the fetus, it can lead on to micropenis hypospadias. It's a the type of feminization of the male fetus, and they can cause masculinizing effect in the females also. Not only that sexual effect, they can also cause metabolic problems like obesity, type 2 diabetes, and all those things. And they can cause psychiatric and behavioral problems in children also. So many effects these endocrine disruptors can cause in our life. Not only in us, these endocrine disruptors can lead on to ecological imbalance also. When it is drained into the water, the fish, when they are contaminated with these chemicals, they lose the reproductive capacity. The birds also can lose the reproductive capacity. So the population of these species which are more prone for this damage can go down, rapid decline in the population of this, and this can lead on to break of food chain and so many ecological disturbances in the society. Next slide, please. So why this environmental disruptor chemicals effect is rising today is because of our industrialization and agricultural intensification. Rapid urbanization causes increased construction, use of plastic material, and the industrial emissions are also increasing, and the use of more and more plastics and all these things leads on to this chemical use. Then agricultural intensification, use of more and more pesticides. Then coming to the environmental changes, these chemicals, when they go to the soil, during the increase in environmental temperature, they can get evaporated, mix in the air, and enter through the lungs also. And we all getting floods and all these natural disasters frequently. From the factory site in the soil, it can be distributed through the city and can pollute the normal streets also. Next slide, please. So how can we prevent this? in the house level, individual and house level, decrease the use of plastic food containers, as already told, especially for heating. Avoid heating in plastic containers and prefer glass and stainless steel containers. Replace old non-stick pans with ceramic coated ones. The PFAs are more in that old pans. Wash vegetables and fruits thoroughly with suitable chemicals and then only take. Avoid canned food and prefer organic food. And use water filters where PFA level is high, where you live in that area where factories are there. Use these filters and limit use of personal care products like your perfumes, aftershave lotions, and all these things which contain unnecessary fragrances, and they can contain these endocrine disruptors. Avoid using them. Next, at the community and public health level, strengthening environmental regulations, monitoring industrial emissions, and improving waste management system, and promoting safer chemical alternatives. Sorry for the typo error. Chemical alternatives. Promoting organic farming. Avoid burning plastics and electronic waste, and increasing public awareness about these chemicals. These are the important things at
Very
the
true, sir.
community level.
Because they come with hormonal problem, they have bleeding also, menorrhagia high, and all the hormonals are normal, and we don't know what to say, and then that problem might lie in the environment. So let us go. 9-year-old girl was brought to the clinic with recurrent episodes of hyperventilation and unconsciousness. All investigations were normal. MRI brain was normal. The history was they were in Chennai last 2-3 years before, and she was studying there. She had a family. The family had recently moved to Vellore because the entire house was submerged in the floods that happened in Chennai. Do you think her present condition has any relevance, Dr. Naushid? You are muted.
Thank you, madam. In
This was her
Kerala,
house.
yeah. In Kerala, we can't forget about Wayanad incident, which has faced heavy rain, floods, and landslides, causing the loss of lives and homes. Many people, especially children, have suffered psychological trauma, and also the disaster have also affected the education. In Wayanad, many schools were damaged or used as a relief camps, which stopped classes and disrupted learning. So currently, counseling, rebuilding of school, and supporting the families are still continuing to help the children recover from the psychological trauma. So, due to disaster, the psychological trauma is one of the most problem. And in most of the when we are going that medical this one camp, some child came like this only, same symptoms. So the children are particularly vulnerable to psychological effect of climate related disaster because their emotional and cognitive development is still ongoing. They often have difficulty to understand and coping with these traumatic events. And common psychological reactions include fear and anxiety about their own safety or their family members, and nightmares and sleep disturbance and suppression anxiety, and sadness, depression, and anger, and difficulty concentrating for studies, and withdrawal from friends and activities, and physical symptoms such as headache, abdominal pain without an identified medical cause. That's the only their presentation. These reactions vary according to the child's age. In preschool children, we may see increased crying, bedwetting after toilet training, and fear of being alone, and regressive behavior such as thumb sucking. And also, the school-aged children often have difficulty concentrating at school and repeatedly talk about or draw the disaster and experience declining academic performance and develop increased fear and worries. In adolescent age, may experience hopelessness about the future and social withdrawal, risk-taking behavior, and symptoms of anxiety, depression, or post-traumatic stress disorder. If the trauma is severe or adequate support is lacking, Long-term consequences may include post-traumatic stress disorder and chronic anxiety or depression, or behavioral problems and poor academic performance and reduced emotional well-being into adulthood. So the recovery is more likely when children have supportive caregivers and stable daily routine, a safe environment, and opportunities to express their emotion through talking, play, art, and writing, support from school and community. So the management focus on providing honest, age-appropriate information about disaster, reassuring the children about their safety, maintaining normal routine as much as possible, and encouraging the healthy coping strategies. And we should support the children. And the other thing is the educational disruption. The climate related that leads to disaster may damage schools, display the families, interrupt the learning, and affect both academic performance and emotional well-being. There are several causes of educational disruption. A school may close temporarily or permanently because of structural damage, safety concern, or because they are used as emergency shelters. And families may be displaced, forcing children to move, interrupting their education, damage to classrooms, libraries, road and transport system, all are damaged. And as well as the lost learning material can further delay the education. This disruption have significant consequence for students, missing school leading to learning loss and poor academic performance. Many children experience reduced attendance and difficulty concentrating and decreased motivation due to stress and trauma. And prolonged disruption may increase the risk of school dropout, and also particularly among vulnerable and low-income children, widening exiting this educational inequalities. And the climate disaster also affect teachers and school. Teachers may experience personal losses and displacement, and limiting their ability to teach effectively also. So to reduce the educational disruption, several strategies are important. These include building climate reliant schools and developing emergency preparedness and continuity plans, and expanding access to remote and flexible learning, and also providing psychological support for students and teachers, offering financial assistance to affected families, and also strengthening the community and government support to ensure the school can reopen quickly. So in summary, the both psychological and education disruption is a major consequence of climate disaster. Beyond interrupting school, it can have lasting effects of children's academic achievement, mental health, and future opportunities. So early preparedness and resilient infrastructure and comprehensive support are essential to maintain the continuity of education and protect the children's long-term development.
True, Naushid. And not only the children who are directly affected, the eco-anxiety is spreading among the youth. And we can see the most of the people who are propagating in the WHO are the youth, from Greta Thunberg, and you have many of the people in UN. The most of them are the youngsters who are doing, and the eco-anxiety as a special phenomenon has spread, and this is receiving more attention now. And we are discussing so much of environment, and we'll just write up quickly with 2 minutes of discussion on this. Do you think even our treatment may be modified, Dr. Bala sir? What do you think? Even our treatment we should modify.
Thank you, Narmada. Actually, we are moving from a disease-based treatment to environment-based treatment. Same disease, same severity, but different environment may require different management. So, for example, air pollution. Here you can see that asthma is just not one disease, but a result of interaction between air pollution, the genetics as well as epigenetics. The air pollution can switch on inflammatory pathways, and this explains previous slide. This explains why the repeated exposure causes chronicity. And genetics, some children are susceptible, have susceptibility genes, and epigenetics, same pollution, but not same response between patients. So asthma occurs when gene load the gun and epigenetics adjust the trigger and the air pollution pulls the trigger. Next slide. So, in this you can see the one area, the picture on the right side is Delhi, and on the left side some hilly area, rural area, where the same asthma will have different management. In rural areas, treatment can be more trigger specific, whereas unlike in Delhi. Next slide.
So do we think that we all need to shift to a rural area? Because what do you think? Because we are living in an urban environment.
Yeah, so it is not possible always, because the solution is not escape to rural. Next slide. Not escape to rural life. The solution is to redesign our urban environment. Why moving to rural area is not the answer, because rural areas may have cleaner air, less traffic pollution, more green exposure, but they may also have biomass smoke, pesticide exposure, poor healthcare access, unsafe water, and occupational toxin. So the concept of greening the city, that is, instead of a great city, concrete building, we can, which leads to a polluted city, we can convert to a green city, which can lead to a healthier city. So the answer is to bring the village benefits to into the cities. That means more trees, less traffic emissions, clean school zones, better urban planning, active transport, and safer air. For children, for better lung development, more physical activity, lower obesity risk, and better mental health. For that, you should have more playgrounds. For asthma, you can have the green spaces can reduce the dust suspension, less pollutants, and the child with asthma living in a near parks often has a fewer symptoms, unlike those residing near the highways.
Yeah. Dr. Sukumaran sir started with outdoor pollutants and indoor pollutants. So just enumerate on this and we'll wind up the session. Thank you.
Okay, this Suman sir and Sadish Agarwal has said, enumerated the pollutants that PM 2.5 from vehicle exhaust, industrial smoke, biomass burning, diesel, etc., can go deep into the alveoli and even enter the bloodstream, causing asthma and other conditions. The PM10 from road dust, construction, pollen, and industrial dust, mostly upper airway, causes upper airway irritation. Nitrogen dioxide from traffic and combustion can cause airway inflammation and worsens the asthma. It's a classic urban pollutant, nitrogen dioxide. Sulfur dioxide from coal and thermal plants and industries can cause bronchospasm and cough. Ozone is a secondary pollutant. It's a combination of sunlight and nitrogen dioxide with volatile organic compounds, which causes airway hyperreactivity and exercise intolerance. This is worse in summer. And carbon monoxide, incomplete combustion causes excess carbon dioxide, especially in closed cars. It binds with hemoglobin and causes tissue hypoxia, and dangerous in traffic and enclosed spaces. And
so now these are the changes we have already so much discussed here. Yes, Bala.
Yeah.
And, now we have real-time monitoring also that has come up here. So here where the human mobility, like we are moving, we have our cell phones, and that cell phones can be correlated with the environmental pollutant at that particular area, and we can actually assess how much of personal exposure has happened. So in short, yeah, we are living in a place where it is, but there are solutions available for the same. So the pediatric office is the front line of environmental health, and we have to think beyond symptoms. Environmental history will be a clinical tool, and it's not an optional extra. We have to do it for every patient. Prevention begins before we prescribe. Every consultation is an opportunity for counseling. From treating disease, we have to move to preventing them. And we cannot prescribe a clean air or an environment, but we can actually recognize what is the environmental illness, educate every family. As Naushid said, climate resilience has to be built up in our own schools, our places, our clinics. We have to vaccinate, promote, wash, and become champions for planetary health. So the best prescription a pediatrician can write is not always a medicine. It's actually a healthier environment in which every child can grow, breathe, eat and thrive. And we as a pediatricians are the only persons where the people will listen to us when they come to us and when we tell, because they don't have answers. When you have an obese child having a premature telarchy or going and having a menarche with a continuous bleeding, the parents are totally and their hormones are normal. So that is a time probably we have to really see. So environmental issues in office practice can lead from a clinical case of a chronic abdominal pain. It can affect our enteric diseases pattern. It can affect our developmental issues as well as in respiratory tract infection. And we need to take an environmental history, promote wash and vaccination, reduces the exposure, advocate for clean air and water, and recognize climate-related illness. Treat the child, investigate the environment, and advocate for a healthier planet. I think that's going to be the lesson for all the pediatricians we have to go. I really thank the excellent panelists for their discussion, the lovely audience who kept, and the organizing team who really gave us the opportunity to discuss such an interesting topic. So I think I would request Dr. Sukumaran sir for the final words.
Thank you very much. This is an excellent presentation, excellent panel discussion, and cases were very, very good. And I think we should promote the usual instead of didactic lecture, we should have a case-based presentation and discussion should be continued even in the environmental chapter. Usually we see this type of discussions in our ID chapter, pulmonology chapter, etc. But environmental chapter also we should continue.
Unless until we discuss in the case-based, I don't think anybody will listen to us.
Anybody, otherwise people will not listen to.
Yes.
And so it should be always a case-based discussion. Thank you very much. Just very good.
Yeah. Dr. Somasundaram, for your final words before we end. Dr. Somasundaram, for your final words before we conclude. Yeah.
Yeah, it was so nice to hear from all of you. So it's actually a new new area to me on here on this right from this air pollution to noise pollution. So thank you very much, Professor Sukumaran sir, Geeta madam, Narmada, Satish sir, and Balashankar sir for your initiative and being the chairperson of this chapter, and for all the work which is being carried out by this chapter. And we are eagerly waiting for the national environmental chapter to be held in this year at Kanyakumari. And thank you once again all the faculties who have enlightened our delegates for the past 2 hours. Thank you very much. Yeah.
Thank you. Thank you all for joining with us.
Thank you, Dr. Narmada, for your excellent coordination, which has brought out this CME in a great. Thank you.
Thank you, sir. Thank you, everyone, sir. Sukumaran, sir, Satish Agarwal, sir, everybody.
Thank you very much, sir, for
Venkatesh sir, thank you for